Ready to go? Well, for all of folks joining us either on Facebook or here in the Zoom room, I want to thank everyone for joining in for this conversation between the Chamber, Adirondack Health, and the Trudeau Institute. I want to thank the Chamber's board president, Joe Shoemaker, for being here with me at the Carry, which is a co-working space in downtown Saranac Lake. And I also wanted to invite and thank Sylvia and Dr. Kuki for being with us. And just to turn it over to Joe for some introductory remarks.
Thank you. For those of you that don't know me, I am Joe Shoemaker. I'm the new president for the Saranac Lake Area Chamber of Commerce. It's been a wild year so far, to say the least, and many of our membership are rising to the challenge of this pandemic and what it's created. It is literally changing the way the world is doing business. As we all know, Governor Cuomo laid out specific metrics each region of the state had to meet in order to start the reopening process. What you might not know is that these two organizations with us today diversified their efforts away from their normal business and put substantial resources into new initiatives in collaboration with each other to meet this challenge. This newly formed synergy was instrumental in the North Country leading the way for reopening, and for this, we sincerely commend them both. This collaboration between Chamber of Commerce members is at its core what the Chamber is all about: moving forward, embracing change, and forming partnerships. This year, the Chamber's Board of Directors decided to nominate two organizations who led an extraordinary achievements and positive impact to the Saranac Lake area community. This year, our board would like to recognize Adirondack Health and the Trudeau Institute for their hard work in moving us forward. It's my honor to introduce to you the president and director of the Trudeau Institute, Dr. Kuki.
Thank you very much. Thank you very much, Joe. Thank you, Patrick. It's an honor to be here in front of this chamber under any circumstance, but what a wonderful recognition. And on behalf of all the staff of Trudeau Institute, we're very, very appreciative. I will show a few slides here and give a little bit of a sense of the kind of things we've been doing, but also, if you will, the spirit of what we've been doing. So let's see now. Are the slides up?
Coming your way.
Okay, everything. Okay, so Trudeau Institute 3.0, partners in safeguarding our health. Partners in safeguarding our health is something I really wanted to say for a number of years, and I have been saying, though I never knew it would be in this format, did I, Sylvia? So now if you look at the, click to advance, thank you. If you look at the aspect of what is Trudeau in a very simple way, it's a global scientific network. We have a scientific network that reaches across the nation, across internationally, Europe, Asia, and so on, as scientists often do, but we have roots here in the Adirondacks. And it's this unique combination, which I think is one of the first things to say about the Trudeau's ability to be a partner in safeguarding our health. Regional bioinnovation and pandemic response. That's really what we're talking about here. I'll particularly be talking mostly about the pandemic response, not so much as what we're doing inside our laboratory, but what we can say, what is essential in order to have the kind of contribution in this partnership are the following several things. So PPE that you all heard about, and then the COVID-19 testing, of course, and PPE and COVID-19 testing are fundamental to clearly the pandemic in so many different levels. What we had been hearing about on the news, at some point you have to say, well, what am I going to do? What am I going to do about it? And ultimately, it turns out that each of us individually, we can do something, but we can do a lot more if we're together. So there's also a bit of a story of the Leadership Alliance here that allowed us to make the contribution locally on PPE and on COVID-19 testing. So on the next slide, this is a photograph of our 42-acre lakefront campus. Of course, that's Lower Saranac Lake, and up on the hill is the Trudeau Institute. This is something that you have to be here to understand. Where I was before in bigger, research centers, I probably wouldn't have used this kind of phrasing, but I am using it here, and I use it very much because I live in this region. This is my home. The benefits of tranquility and continuity. The benefits of tranquility and continuity. There's something here. With total dedication to fighting lethal infections that plague humankind. This is exactly what I would have said a year ago in the context of, say, TB and other things that we're working on, whether it's influenza or Zika, but it happens to be rather relevant, I think, to today. So, talking about alliance. So, Adirondack Health with Sylvia and us, we have defined that uncertain times call for steady response. And we had an early newspaper piece about this. What kind of pandemic response can we put together in Adirondack Trilix? So right off the bat, what I'd like to do, click on yes, is mention that we took immediate action. And what is it? To care for those on the front lines who provide us with health care. They provide us all with health care. What can we do to care for them? And there's one very specific thing, the N95 mask decon for nurses and doctors. So we stepped into that. This week, we're doing decon run number 18. And we adapted Duke medical procedures. A lot of this stuff is known. So a lot of it was actually worked out in the Ebola days. But this is a kind of network that we have. We pull in this information. We do a lot of it to test ourselves. We can test the sterilization in extreme manners with the Trudeau laboratory. And we knew it was working. And we dedicated a special room in Trudeau, which is perfect for this kind of thing. The result then is that not only did we start down the road of helping those and protecting those who protect us, but we realized that really the Trudeau is committed to these new roles. And as a regional resource, what can we do with new roles in health infrastructure? So then I need to ask, what are we doing this as we're a bunch of PhDs and research technicians who work in the laboratory, and here we are helping with the front line of healthcare. Well, I knew it was the right thing to do, but if you really ask me, so how do you really know it's the right thing to do? Then what I need to do is emphasize our history, our Adirondack roots. And it comes exactly from Edward Livingston Trudeau. This is the bronze statue, very, very famous. That's right outside the Trudeau Institute. The history is 1884. The history is TB. He's in the pose of curing from TB, and he did cure. And we're talking about right today, regional bioinnovation and outbreak response, but how do we know it's the right thing for Trudeau to do? Because all I have to do is ask about ELT, Edward Livingston Trudeau. Our founders were MDs. Once you get that in, then it's pretty clear we're in the right path. We need to do this and work with MDs. Next. So we didn't only do the masks. As we know, people have a need for tests. So at this point, we've delivered 10,000 vials of testing liquid for the local COVID-19 testing. Again, it's a local impact. And you can see these vials. There's a code TIBTM. TI means Trudeau Institute. And we're supporting our partner Adirondack Health in mobile van testing and whatever else you need, Sylvia. And we're delighted with that. The mobile van testing is out and amongst the different communities across the counties. And honestly, the pinch points like this shortage shows how dangerous the impact is of pervasive rationing and a lack of supply, hurdles and shortages everywhere. I was a little shocked at the extent that can happen, but the severity of the pandemic is of this kind. So what do? Talk about the news or be part of the news, to step into the news, to say, okay, the Adirondack spirit of resilience and vanguard leadership, that's what we want to look for. And from the days of Edward Livingston Trudeau, this guides us and inspires us. So these files enable a patient sample, of course, to be delivered to a remote central COVID-19 testing lab. And then, an example might be LabCorp, though right now we're able to get the specimens there, but the centralized labs are being hammered by the needs surging from many other states. So that's one of the attributes of a centralized lab. We haven't dealt with that one yet. Okay? So what we are saying, however, is that we're proud to contribute as best as we can on first steps to the solution of regional bioinnovation and pandemic response. Now, let's take a look at this thing. To a scientist, this is not a mystery. This is a transmission electron micrograph. You can see a scale bar. This is not a mystery. This is a very particular virus with a certain yellow bilayer. It's a lipid coating. It's a color code that's yellow. It's not actually yellow. So there's a bilayer, which is the thing that's destroyed if you wash your hands very well for 20 seconds or so. And then the things poking out, which give the name coronavirus. So to scientists, this is a virus, and there are many viruses. However, what we can say is that this particular virus is, of course, SARS-CoV-2. That's what the image is of. And SARS-CoV-2 coronavirus causes the COVID-19 disease. So let's advance a couple then. And this lurking, invisible threat is visible to biomedical science. If it was the size of a golf ball, I think we would have an easier time figuring out what to do with the thing. Okay, it's invisible to most people, and what a way for all of everything to respond to it, all the churn, all the arguments, everything else, because it's invisible, and invisible things are naturally frightening. It is urgent that the testing continues to detect this, to be able to make it visible, but it needs to advance beyond medical diagnostics now to a bigger picture, which is early case recognition. And again, this is something in which Sylvia and the team here have been leading a lot of the remote van testing. It's not medical diagnostics to treat patients, it's early case recognition. So early case recognition is exactly the phase we're in now. The whole country's in that phase. That means picking up those individuals who don't even know they're sick, but they're carrying the virus, unfortunately, with the ability to spread it. So this is my little comment about detecting the virus. It all ties together. Okay. Lastly, I wanted to just mention that we're understood how powerful the Leadership Alliance is. We're not done. We're growing a Leadership Alliance. The connectedness, one of the things I learned is the connectedness of science, healthcare, and business is so clear. As mentioned by Joe, the ability to provide the scale up in testing helped the region, this actually a 7-county region, meet the criteria by the government to reopen, which is a business issue. So, and an issue for all of us. So there's a direct connection to provide the testing and meet the criterion from the governor. So this is connectiveness has never been so much clearer. And I want to mention that we are in fact building this Leadership Alliance further. Just build out. There we go. So now we have 3 presidents in conversation, not only Sylvia and myself, but also Michelle LeBeau, the president of Plattsburgh Hospital. And we have advisors who are well known from, especially from a business perspective, in some cases a political perspective, Gary Douglas, Bill Owens, Kip Testweed, joining Sylvia, Michelle, and I in this Leadership Alliance. And this is where we're headed next. Kip Testweed, in fact, is not only a Lake Placid resident, but a vice chair of the board for Trudeau Institute, and he's with us today as well. So I wanted to thank you, and this is the sort of a picture that says there may be a number of discrete things that we're very proud to have done, but I think there's some dynamic behind it, there's some logic behind it, there's some unfinished business behind it. And thank you very much. Oh, this is extra. That's extra slides. On behalf of Trudeau again, thank you very much.
Mm-hmm. So I'll go ahead and join in as well, and certainly add my thanks to the Saranac Lake Area Chamber of Commerce Board, for selecting us as Co-Business of the Year. I can tell you we are proud chamber members, and we really do appreciate the great work that Patrick, Emma, and of course Shadow do for our communities. Whether it's business opportunities, all the networking opportunities, and certainly workforce development across the whole Saranac area. So thank you. And I have to tell you, I'm really proud to be sharing this virtual stage with my honored, esteemed colleague, Dr. Cookie, and I think now friend as well as we go along. And certainly I want to thank, I know we have a couple of our board leadership here, Jeannie Cross and Kip is here with us as well. So I wanted to thank them for joining us in celebration. There hasn't been enough to celebrate lately, I have to tell you, in my industry, and so this is so special. Thank you very much. One thing I love about this area, and I love rural areas. I work in rural areas by choice because there's something unique about the way community stakeholders can come together. I can tell you, times of crisis are certainly inevitable. Certainly in my field, they are. But when you see stakeholders come together and working together and problem solving together, it's truly inspiring. It really is. And I think it helps us get up every day to challenge the next opportunity as well. And as you all heard, Dr. Cookie and his team at Trudeau, these are global experts. They're experts in the field of infectious disease and immunology. You just saw that, you just heard that. And I can't tell you how amazing it is. It's so lucky. It's not just lucky, it's providential, I believe, to have that type of an organization just 3 miles up the road from Adirondack Medical Center. And it was certainly providential this time around for us. But of course, we share common ancestors. As Dr. Cookie mentioned, certainly E.L. Trudeau, he was the first honorary president of General Hospital at Saranac Lake. And then certainly Dr. Frank Trudeau was founding president and also chief of medicine at the hospital as well. So, I guess we're connected going way back and proud to be so, I think, overall. But I thought it might be interesting for you all to get a little glimpse of what this really meant to us. And I kind of hate looking back because it's been a long, hard road for us as an industry. But when I do look back, I can tell you, I will never forget, never, the night we received our first batch of Trudeau manufactured viral transport media, or VTM, as we call it. I remember the date. It was April 30th. It was literally minutes before the start of a hospital board meeting. As Dr. Cookie mentioned, testing was very limited back in the North Country, not just in the North Country, in the entire state, in the entire nation. There was a shortage of VTM at that point. A lot of people called it testing kits. We kept hearing about kits, but it was really the specimen collecting and transport media that there was a shortage so that we could get test specimens to the national commercial labs that we took care of. And that shortage put us in a rationing position, which is just something we've never had to deal with on this scale, where we really had to prioritize testing. And we did get state guidance on how to do that in terms of prioritization, but it's just so difficult. I have to tell you, those early weeks and months were pretty bleak most of the time. We were making choices we never thought in our careers we would have to try to make. And then the call came in, and I can tell you, our now retired chief of our lab, John Sidley, he was so excited that he ran out, jumped in his car, and drove to Trudeau. And turned around with 2,000 units of the VTM in the back of his Grand Cherokee. And with that move, that increased our ability to test tenfold. I can't even tell you what a relief that was in our industry. And since then, we've processed more than 5,200 specimens using the Trudeau VTM. So I've told Atul at one point, I don't use the word game changer lightly. This was a game changer for our community, for the economics of the region, and certainly for our patients and community members as well. So it certainly will stand out in my career as well. So of course, being overachievers, they didn't stop there. As we mentioned, also the help with our surgical and N95 masks that we had, also in short supply. It's actually a little depressing to me that you as community members now know the acronym PPE, personal protective equipment, which we use in our industry, but became commonplace as everyone now is in a position to try to protect themselves and each other as we go forward. Some of you might remember the stories, horrible stories, on the nightly news that, where they showed nurses and doctors, some of them wearing the same filthy masks for days on end. You know what? Not here, thanks to Trudeau. And so I remember, actually it's interesting, one of my colleagues came back from talking to one of your Trudeau team and said, gosh, they were explaining to us that there's numerous structural deficiencies of COVID-19 virions, excuse me, because I'm not a clinician on that, and little individual bits of virus. And so to us, we suddenly realized that, this previously unknown, right, to us unseen, extremely contagious, highly lethal virus sweeping across the entire globe And here we have professionals, experts, scientists that are calmly describing the virus's weaknesses and the relative ease. We can easily destroy it with vaporized hydrogen peroxide. And it took our breath away, it really did, because I don't know about all of you, but these are the professionals I want to oversee the sterilization of my staff's masks, right? To keep them safe, and thanks to Trudeau. So I get a little emotional because it was difficult times. So thank you for the partnership. More than 90% of our masks here have been sterilized and repurposed, sometimes up to 20 times. And I can still be assured that it's keeping people safe. So it not only did that, because, again, Trudeau overachievers, it gave us some breathing room so that we could share some of that wealth out. We were able to give N95 masks to some of our police, some of our first responders, and make a difference for them as well. So I could go on and on, right? I could go on about their professionalism, the collaborative spirit, but I'm not a clinician, but I know that Zoom fatigue is now a real thing. So I'll probably cut off the anecdotes here and just close by saying thank you. And thank you to the Chamber for selecting us. It means so much to the great people that you're seeing up on the screen that I have the honor of working alongside. So thank you so much. You'll notice the Adirondack chairs are socially distanced. We thought that was an important touch for you all. Thank you. We share historic roots. And you know what? We're going to continue to work together to serve this region into the future. So yeah, thank you again so much. Much appreciated.
Well, I want to just reiterate congratulations to the two organizations, to Adirondack Health and to Trudeau Institute, for the ingenuity and the flexibility and the ability to be able to reach out to other organizations in the area and to partner and to do things that really were necessary to help keep the public safe during these times. And on behalf of the members of the Chamber of Commerce, I want to say congratulations for being selected Co-Business of the Year. It's a very unique circumstance, I think, for that to happen, but I think this is a time in which there's some unprecedented things happening. So again, congratulations to the two organizations and to all of the employees at both Trudeau Institute and Adirondack Health for all of the amazing effort that they have been doing day in and day out to continue making this area able to stay open for business, but also to remain healthy. So I want to thank all of the employees too at these great organizations. With that, I would also like to invite Kip Tesweed, who happens to be the Vice Chair of the Board of Trustees for the Trudeau Institute, for a few words. And I will find Kip here in our room and invite him in to say something. Hello, Kip. Thank you for joining us.
Can you hear me? Yeah, we're set.
Yes.
Okay, great. Well, thank you very much. Thanks, Joe and Pat and the entire chamber for this incredible honor. We're really, on behalf of Dorothy Fetterman, the chairman of the board, and the rest of the board of trustees, we are really honored at Trudeau to receive this honor in addition or as co-honoree with Adirondack Health. Personally, I'm humbled to be associated with Dr. Kuki and his an entire team, the men and women of Trudeau that stepped up along with Adirondack Health to really make a difference in this very difficult time. It's, to have increased the volume of testing and be able to reopen the economy at a time that the rest of the state was really struggling to reopen, to meet the criteria of the governor to reopen is really remarkable. But as Dr. Kuki said, the ability to have an increased volume of testing is tremendous. I think when you think further about the alliance here, you've got alliance between science and medicine as well as business. And I think for the chamber, as business folks, you can imagine that businesses need confidence both to grow, to prosper, and to reopen. And clearly having a greater volume of testing is one step, but having more rapid results of that testing. As Dr. Cookie said, some of these tests are the vials that are provided have to go a long way to be tested, and often run into bottlenecks if there's a extreme outbreak somewhere else. So to have rapid response testing, I think, is our next step to building confidence in the area. There is a plan underway to achieve this with this alliance that was explained, and that could be really beneficial to the Tri-Lakes area. So I think as we as business folks think about the confidence that a rapid result, say 24-hour result of a test, could mean to our customers, to our employees, to the community at large, and to any tourists entering the community, I think we have to think ahead and plan for this and see if we can get behind an effort to support a rapid response testing initiative. And that's about all I want to say here, because I don't want to take a lot of additional time in what is really a celebratory meeting. But if you'd like to learn more about this or try to support this effort as a business person, it would be great to if you could get in touch with me or through anyone at the chamber, and I could work with Sylvia and Dr. Cookie to try to move this forward. But we'd love to have some business support for a much more rapid local response testing facility. So once again, thank you very much. We really appreciate the honor. And
Great, wonderful. Thanks, Kip.
you bet.
Thanks for providing some insight into where you think the community needs to go and where some efforts need to go within the community. And I think there's a lot of folks listening in, and we can definitely talk amongst the members and the chamber board to see how we need to be able to help support you folks too in your efforts, because you've done so much for our community and to help move it forward. So thanks for providing the insight and for extending that invitation. I appreciate it.
That'd be great. Thank you.
Next, I'd like to invite Jeannie Cross, who happens to be the chair of Adirondack Health, and I'll find her and invite her in to say a few words. One second, Jeannie. I'm trying to. There you go. Hi, Jeannie. Thank you for joining in with us. I appreciate it, and congratulations to Adirondack Health. Would you like to say a few words?
Yes, and basically what I want to say is thank you. Thank you to the Chamber for this award. Thank you to the businesses and the individuals in the community that supported us. Our fundamental mission is to try and keep the community healthy, and that became exponentially more challenging starting sometime in March. And I know that the staff greatly appreciated all the support, from the signs along the road to digitally printed face shields to home sewn face masks, food, and now this award. It really means a lot to know that your efforts are being welcomed. And I also want to add my thanks to the Trudeau Institute for all that you have done for us. We could not have played the role we did in helping reopen the local economy without the testing kits. I'm sorry I used that word, but without that testing media, we would not be able to do what we have been able to do, and that's been a tremendous help. I think to the mental health of the community, as well as to the physical health of the community and to the health of the economy and getting things back on board. So on behalf of the entire Adirondack Health Board, I just want to say thank you in all caps.
Well, thank you, Jeannie, for joining us. And it has been it's been phenomenal to see the community rally around each other during this time. And there's not any other place that I would rather be in than in Saranac Lake, because of this, the efforts that we're talking about tonight have really demonstrated the type of spirit that this type of community has. So thanks, Jeannie, for joining us and for participating. We have some questions that actually came in ahead of time that I'd like to offer to Dr. Kuki and to Sylvia to see if we could help provide a little more insight into kind of how the partnerships started. Hold on one second, and I'll get you folks unmuted. Great. So I think one thing that Kip, I'll start with this by just saying this is a very celebratory night, and I want to keep that in mind, because there's a lot of things happening in the national discussion right now that may not seem so uplifting, but this is a story that I think really was important to talk about and to highlight as something that's a positive story. And I know that I would like to reiterate that we're not out of the woods yet on the course of the pandemic, and to be able to correctly be able to confront the issues facing us in our economy, but also with public health. So personally, I would say to folks that please remain diligent in social distancing and wearing a face mask and washing your hands, not touching your face, and being able to care for other individuals in the community, and to put that forward to show that type of respect for other folks. So Dr. Kuki, could you help explain a little bit of just how this partnership began with the testing? What was that type of eureka moment that kind of went off, that kind of started this initiative?
Well, certainly. So this is a very personal story because there is a husband and wife couple involved in this one. And the wife is a physician in Adirondack Health here, and the husband is a long-term research staff member in Trudeau. And so they were talking about this. And so it doesn't get more personal than that. It doesn't get more natural than that. I suppose it's a good reason to make sure your husband-wife situation stays as good allies, because it's hard to they nailed it. And so the idea came across to me, so why don't we make this liquid? It's not that difficult. And the first thing I said was, yeah, it's not that difficult to mix it together, but you have to understand, we have to nail the quality. We have to really nail the quality. By the time that conversation, which took maybe a week or more, went through, I was surpassed. We had other members of the Trudeau staff were saying what their standard of quality was, which was very, very high. So I started to feel like, okay, we can probably deliver something that's high quality. It's done under, a very special circumstances. It's certainly not our business. So it was a husband and wife, and it was an idea that went much further than I could tell at the beginning, because I analyzed it more like a business. Is there a business? No, it's not a business, so on. But I learned pretty quickly from that.
Well, that's really interesting that it happened to come organically between a married couple that bridged the gap between the two organizations. How did the arrangement come up for the decontamination for the personal protective equipment?
Maybe oversimplify a little bit, but in this case, this is one person getting along with herself. So we have a staff member who is also a nurse. The same person, the same person. And so this sort of occurred to her that what she was seeing, clearly there should be a better way to provide protection for those who are on the front line and help all of us with their care for us. And so she basically, started to broach the subject, and again, started to talk around about the different ways in which we could do that. And again, and we knew that there were methods, Duke Medical and others, but at the end of the day, again, the Trudeau staff sort of took it to another level, and they really drove the quality. So I could be reassured that, again, when you're doing something you don't normally do for your day job, you can't just say, assume, right? That necessarily that it's something you can just turn on. But they did convince me with the rigor and the quality assurance, and so that we turned that on. So that was one individual staff member.
Well, it all comes down to, I think, individuals taking an initiative and not being afraid to bring up new and different ideas. Sylvia, along the same lines, have you heard of collaborations like this elsewhere in New York? Is this something that is somewhat more unique to our area, or are there similar initiatives going on elsewhere?
You know, I haven't heard of anything specific to this level, and I credit that. Although again, there's been all kinds of creativity and innovation everywhere as our industry and our communities and our businesses have tried to figure out. You know, I hate to use the word unprecedented, but that is what it is, and that calls for new ideas and new approaches. But it also calls for partners who, you know, I believe have some knowledge of each other and also respect for the level of expertise that was at Trudeau. So this wasn't just, you know, my son cooking something up in the basement kind of a thing. This was a respected global leader that actually had the foresight to say, well, let's take a look at it. They didn't just shut the door, as Dr. Cookie said, and say, I'm sorry, that's not our, you know, our job. That's not in our wheelhouse. They were like, well, let's give it a look. Let's give it a shot. And I think that's very different. And it was different on the standpoint of being able to actually take a risk and take a step forward on that, but also just the incredible level of expertise that was needed to assure the safety, both of the media, to make sure that we were getting the appropriate response for people and their diagnosis, their screening as well, but also, you know, literally putting our staff's faces in their hands. And so to me, being assured of that really rigorous quality control that Trudeau had made it all possible. So I do think there's a lot of innovation. I think, you know, people will be studying and reporting on these types of things everywhere. I don't know that I've seen the combination of the shortage that you have combined with a resource to solve the shortage in exactly this way. Because again, two of the biggest areas of shortage through this entire thing has been testing and PPE, and continues to be so.
So is there areas that either Trudeau Institute and Adirondack Health are looking to collaborate on in the future? Are there areas that you're exploring, Dr. Cookie, that might be an area for collaboration in the future?
We are certainly not done. And so, yes, there are, the two comments I would make is that we're broadening the conversation to the larger set of leaders. As I mentioned, there's a fairly active leadership alliance that's looking at our best opportunities to make the most impact. And what you know, as this is very rapidly unfolding situation, and try to digest new information. And so we're getting a lot of advice from a lot of these leaders, and it's now been expanded to business. So science, healthcare, and business, so that extra component. And I think also our Vice Chair, Kip Teswe, specifically mentioned one of the areas that we're having a good hard look at. And that's to improve the turnaround time, which requires us to not depend only on these remote, they're very large, but very remote and slightly overwhelmed remote testing centers. So we're not done. We'll keep going.
So out of this partnership, are there certain things that you have learned, or certain traits of the type of endeavor here that you think is kind of the moral of the story of being able to reach across different organizations and to cooperate? Where do you think other folks might be able to look to this as an example and follow through on it?
Yeah, I'll jump in. I mean, I think, you know, as Dr. Cookie mentioned earlier, you know, I think keeping an open mind as you tackle challenges, I think was key. I think, you know, not instantly dismissing something as far-fetched or impractical, or maybe taking too long. You know, we thought about our world since March. Our world is always fast turning in healthcare. It turns at a different speed than the research entities that are out there. But instead of just assuming that the other party may or may not be interested, I think just reaching out and having that conversation is key. And I think being, you know, I tell people I'm sometimes an irritating optimist, but being optimistic and thinking there's got to be a solution if we can just look at it hard enough on that. And I think that maintaining that optimism irregardless of what you're seeing around you, I think is key.
I want to echo that. I'm also an optimist, so I guess we have something there really in common. I'm an optimist who will look at news and then get irritated just reading about it, and then I want to know what my place is in it. You know, to be a professional is another thing about this moral that you're asking. What's the moral of the story? You need to both be a professional, knowing exactly what you know how to do, but you also need to not be tied down by it. You have to ask, what can I do? And this idea that it's very easy to actually be very successful as a professional, but then stay within that box. And just for PhDs and MDs to work with each other, it actually takes a lot of extra effort. You know, I've known that over my career. So instead of staying within the box, yes, you need to know your professional expertise, but then you should ask, what more can I do? What more can I do beyond, you know, your core, home base, comfort zone professional expertise? And for me, certainly, you know, looking at the news and being an optimist, saying, no, I don't accept this. But, you know, you have to channel that. You have to channel that. If you just want to talk about it, that's not going to get you very far. You have to channel that into something you can do.
Well, I think that kind of highlights the one of the main reasons I think the Chamber Board was so interested in being able to highlight this type of collaboration was because of that organization effort that kind of was outside the box, kind of different thinking, to really highlight that this is how folks might be able to look at something, as Dr. Kuki says, and feel that you want to participate and get out and be involved, and to understand where your limitations are, and maybe to look to someone else to see how they can complement those limitations. And so I think that's kind of a really, really strong message that I heard from you folks. Sylvia, if I wanted to get tested, where could I go to get tested?
You know what, the COVID clinic, I have to read the phone number though, I don't have it memorized. So first step absolutely is call our COVID clinic. It's area code 518-897-2462. And that's absolutely where you start. It's open Monday through Friday, 8 to 4. We're also doing some expanded hours. We're also, as we mentioned, we have the mobile unit, which was again a providential resource that we had in our toolbox that we repurposed. And we're trying to keep kind of an eye on testing results that we see, and or just areas of concern that we hear across our Tri-County area. And then send the mobile van there so that we can continually see what the nature of the COVID pandemic looks like for our communities. And the best way to make that visible is with data. And as Jeannie Cross mentioned, there's also certainly a peace of mind component to it. But for us, it's really about surveillance and data so that we have a better sense of what the challenges are for our area of the North Country. So please call the COVID clinic. Hopefully, maybe you can put the number up. Guys, oh, it's up there already. Oh, there it is. Because Matt Scollin is faster than I am.
Yeah, he's on it.
So
and then how often can people get tested, or should they get tested, or what's the protocol or the logic behind that?
Yeah, that's a tricky question, and we'll get you a more clinical answer. It depends on the test, and it depends on your circumstance. You know, if you have been self-quarantining for 14 days and have had no external exposure, obviously getting tested once sometimes in that time frame would make sense. But we'll get a little bit better guidance out there for you. I will say testing is still a very complex topic. There are many different kinds of tests. There's many different vendors out there. And so talking to your physician and asking that question is always your best way forward. And like I said, or, you know, again, if you need people to give us a call, we're happy to try to help direct that. But there's a difference between, people now know, between the antigen testing, the serology, that's for the antibodies, the PCR, and there's more tests coming out every day. I don't even exaggerate, about 20% of my inbox is filled with various people hawking tests and PPE, a good portion of it which is not valid material. So complex topic maybe for another as we get forward.
Well, you were talking about how important it is to follow the data and to understand what the trend is going on in in the community and to understand kind of what's happening with testing and positive results. Could you do you have a little bit of maybe information there that can just help highlight what's the current status of our positive cases and just provide just a little of an update on where we currently stand?
Yeah, I certainly can. We obviously did pull data. It's actually as of last night, Sunday night, data, so I don't have what's coming back. And when it gets reported, it's getting reported, from the national labs back when they get the results. So there is a little lag in reporting. But right now, across the whole North Country, the 7 county regions, interesting, 82,000 people have been tested, actually 82,068 people. And there have been 595 positive results. So right now that's a 0.62% result, which is good. And we have noted though that isn't necessarily going down. It's really kind of, I think of it as kind of bouncing along the bottom, if you will, up a little bit maybe one day, down a little bit the next. We're seeing that across the state as well. I'm on daily calls with a number of different entities looking at that data. And of course, the reason is, again, it is time for celebration, but I also feel like I need to be the bearer of news that, we can't prevent this virus yet. We don't have a definitive treatment for it yet. And as I said, the tests are still variable and a little slow to give us the ability to get to peace of mind. So good news, I think overall for the North Country. We're all watching what's happening in the surrounding states very closely. And we, like I said, we're monitoring. I can tell you the happiest part of my day, believe it or not, just shows what my days are like, but is I do see the test results on a daily basis. I hold my breath every time there's a positive. I can tell you out of all of the pre-operative testing we have done, to date, we've only had 2 positives out of probably over almost 1,500 tests that we've had out of that. So I look at every one of those because you know what? Every one of those tests is a person and a life that's under our care and direction. So, again, keeping up the good work that we've done in the North Country on keeping people safe.
Yeah, I think that just reinforces the message that we might be in a bit of a bubble up here within the North Country for whatever reason that you might extrapolate out to why, but that's the facts as you've stated within the data, and it's really important to keep diligent and be stubborn about wearing that mask and about following the proper protocols and to understand what those guidelines are that the governor's putting out and to try to follow them so that we can continue having those mini victories and seeing those test results come back. Which will bring me to the next question I have, which is Sylvia mentioned that there's no way to be able to prevent this yet. So Dr. Kuki, I ask you, what is a current status out there in the world on developing a vaccine?
Okay, well, we definitely need a vaccine. And, my joke about the Adirondacks is, hey, up here in the Adirondacks, we're about 600 feet away from each other. That works. If you want to do that forever, that will work quite well, actually. But otherwise, you're going to need a vaccine even here. So there are like 100 vaccines moving forward globally. It's the largest enterprise I've ever seen in any biomedical effort because it's all synchronized, it's all launching at the same time. It's staggering. So we're looking at a progress which is never been seen before, but actually if you're in the business, you can see the roots. Where did it come from? It's prime. I'm going to give just 3 quick examples. They're random, just random examples. Some of them are not totally random. One example would be you look at a company like Merck, which is more of a stable company. They're not so flashy, and so people pay a little bit more attention because they just pound away. And so they basically have had an Ebola vaccine success, okay? So they're building off of their Ebola vaccine success for COVID. There's no question that's logical, and Merck is going to be a player at some point. Notice that nobody is doing what you do for influenza. You do not take this virus and try to inactivate it, and give it in either killed form or live attenuated. No, we don't do that, the influenza trick. We with this one. This one is not the flu. So there's the Merck's approach, and they're cooking along. There's going to be a lot of buzz around the Moderna. I'm just using it because I love technology too. Moderna's got a really cool technology that's called the so-called mRNA platform. So this is a version of a transient genetic therapy. It's transient, doesn't change your body forever, but it changes your body a little bit for a little short time. It's moving very fast, and Moderna's technology came out of the pursuit in the biotech industry to say, how do we respond to something that's an outbreak? How do we respond to outbreak? What's the fastest way you can respond to an outbreak? And it's certainly not to play with a virus. It's simply to play with the nucleic acid, because then actually nucleic acid is the same. It's the same. It's the virus has it, bacteria have it, humans have it. So Moderna's technology, the platform comes from that drive in the biotech business to do better to outbreaks. So bang, comes in, Moderna jumps on it super fast. It is, however, new. There is no vaccine based on this platform. Whereas, for example, Merck had the Ebola. Now, the third example I'm going to give is from Oxford, University of Oxford, over there in England, and they got partnered with AstraZeneca. There's actually a beautiful article in Bloomberg Business on this, how that happened. But their vaccine is actually so-called the chimp adeno platform, okay? And so that particular platform has been in people. So it's definitely innovative. I know of it through efforts to use the chimp adeno platform to fight chikungunya. And it's moving very, very fast. So I would say that just using those three examples, those are very solid examples. They're moving fast. You're going to get some, I think, very good news from the clinical trials on at least a couple of these things in this year. And I think the Oxford one is the one I happen to like. But that being said, that doesn't mean that it will solve the whole problem. And so these are very, very complex things. Normally vaccines cannot be done this fast. And it's not just can you push hard if you pour $1 billion into it. It's also what you have to learn from working with people. So I do not believe that anything that comes out gets even some kind of partial approval in 2020. There's no way that those things would be something you want to give to 350 million people. It's not going to be, that is impossible to speed up the knowledge that you have to learn. But I would say that the cases, the examples of these vaccines moving forward, I mentioned 3 completely different platforms. They're all different from what you do for influenza. They're actually mostly based on precedent. These things were hooking along for something else. The Oxford one, MERS, they were doing it for MERS. And the MERS vaccine, it's very, very close to the coronavirus. And so it was the easiest for them to flip right over with the highest confidence to this current virus because they're working on the MERS virus, in Saudi Arabia and so on. So a lot of base in the science out there, a tremendous number of very hardworking scientists in the labs throughout the world.
And for folks who might be a little bit less aware of that process of what it means, the scientific method of that goes into developing the vaccine, why does it take as long as it does to do a vaccine safe and effectively and to bring it to such large scale that we can get it out into the population so that there's enough of a immunity out there to be effective? Why does it take so long to do that?
Well, I think you touched on some of the ingredients. So it's like, how many reasons are there? You mentioned production. I'm talking to business folks. So production is definitely a huge problem. Remember, you have to produce something that you're willing to stick in millions of people. It has to be not just slightly pure, it has to be unbelievably pure. Because unlike most medicines, in the case of vaccines, they're unique because you're putting them into healthy people. So the standard is extremely high. So manufacturing is a massive problem on this scale. And the ramp up, how do you do ramp up at this when you have maybe easily dozens and dozens of valid candidates? You don't know which one is going to be the one. But also, what everybody knows is there's some kind of testing that has to happen, clinical trials. So phase 1, phase 2, phase 3 clinical trials. And what you're doing there is methodical analysis. This takes a lot of time to recruit the patients and to do the tests at smaller, medium-sized, and finally larger cohorts of volunteers. And you're doing these random clinical trials. They have to be done in a very rigorous statistical way to test that you're making a difference. And as you're doing these trials, what you're looking for, the very simplest thing is your vaccine immunogenic? That's like, you can do that in phase 1. So to me, it's slightly hilarious that the stock market will react when somebody gets a good phase 1 result. That's like, yeah, if you don't get an immune reaction, you come on, that's minimum for being professional in the vaccine field. But you have no idea if it's protective. You just mean the person has some antibodies. So that's a long way from having antibodies to being protective. And it also, of course, matters how you're challenged, okay? The dose. So wearing the mask and so on and so forth is a good idea for lots of reasons, because it will reduce the dose even if you get some of the virus, and your immune system will be better. But in separate from phase 1, phase 2, phase 1, phase 2, phase 3, which is the more obvious component that usually takes 5 years, you need to know whether or not you can give this to healthy people of different ages. Can you give this to teenagers? Can you give this to children? Can you give this to elderly? Those are all separate questions. There is no other way to learn that other than doing very careful controlled clinical trials. You need to learn who you can give it to. Can you give it to somebody with diabetes? Can you give it to somebody with other conditions? You have to learn all of these things. And so it'd be a lot easier if all human beings are homogeneous. Then it would be easier. Just do phase 1, phase 2, phase 3, you're done. You actually need to deal with the fact that people are different. And for some people, you better not give this vaccine. Or for some people, maybe you should give, the Oxford vaccine. Other people, you should give the Merck vaccine. So the different vaccines are going to be needed because we're not going to be able to learn in a more methodical way, which typically takes 5, 10 years, truly how to master the application of a vaccine to 300 million people. The best thing I can say is that the number of things moving in parallel is unprecedented, and that's good for all of us. It'll be the fastest thing we've ever seen, but you're still going to have to go through the hard slogging, find out which vaccine you can give to which person in their particular individual condition, and be the right cost, safety and a risk and benefit for that individual. There's some things you can't short circuit. We're going to see some amazing progress coming out of science, but it's still not going to be just turning a switch.
Well, I find it interesting that you say it's, usually it might be 5, 10 years for something like this to come out if it was just within a non-crisis type of event. So it's really startling to hear that some clinical trials are happening and that maybe within 2021 we'd be able to see some type of evidence of where that might be going so quickly, because by then it'll be about a year of when we were aware of it. So that's really kind of indicative, like you said, of where the technology is, but still needing to do it the correct way. So
it'll be a combination of many things. A vaccine that starts to help some people could happen sooner than I could believe, and that's great. But that doesn't. We're going to need a combination of many different things to get ourselves out of this.
Which highlights this one. I think one last question that I have, and I'll offer it to either of you, but I'll start with Sylvia about just how best to communicate from the business perspective. We're in the middle of some of our busiest time of year for visitors that come up here, and to be able to experience our natural resources that we have and invite them into our communities, how best we can be able to communicate to our visitors and to customers of our businesses to follow those public health safety guidelines, and what might just be a good way to be able to help communicate that.
Yeah, I had a mother who told me a long time ago that you lead by example, right? And so I really think key for all of us is such a simple thing, Mine's a lovely shade of purple that my assistant made for me. I'm excited about that. When I step away from this desk, this is what I wear in this facility, even if it's a healthcare organization. And so I think those of us in leadership in this entire area, if everybody sees everybody wearing a mask, guess what they are more likely to do? And I really believe in the premise of what's the worst thing that can happen, right? So what's the worst thing that can happen if people wear masks and keep socially distanced is that we all stay protected. And I tell people, I wear this mask not to protect myself, I wear it to protect you. I work in healthcare and I know that, right? So to me, the worst thing that can happen if you don't wear the mask is that I see you in my facility and not in the most positive way, not just stopping by to visit, which I'm open to visitors, by the way, but I think the worst thing that can happen, standard to me is important. But I think those of us who are business leaders and who are leaders need to lead. The old line is show, don't tell. And so I've been committed to making sure that if people see me anywhere out and about, and again, if you see an entire community wearing a mask and behaving appropriately, I think we'll all get through this, and people will pick up on that pretty quickly, right? So that's the best advice I can give at this point.
Well, I think that's a great mantra, to lead by example. And if members or businesses in our community need assistance locating face masks or hand sanitizer, the Chamber of Commerce, we have a supply that was generously provided by Franklin County. Franklin County is able to get access to some of these supplies for our local businesses. So please reach out to us so that we can have that on hand for your business, and that we can be able to, like you said, lead by example. So I think that's a great way to end this. And I think I want to reiterate my thanks for you folks joining us tonight. And again, our congratulations on behalf of the Chamber, our membership, and the board. And I'll just allow Joe to kind of wrap things up here. But I want to thank both Sylvia and Dr. Kuki. Thank you very much.
Yes, thank you very much again, you guys. Hard work paid off. Our chamber is moving forward. Our membership is moving forward. Our communities are open and opening more and more every day. Your hard work and dedication to each other in this community is definitely something that we applaud. So thank you very much, you guys.
Well, you promised us an ending with a big smile. The smile's still back here, even behind the mask. So very big smiles. Thank you so much.
Awesome. Well, thank you very much. And thank you everyone for tuning in, either in our Zoom room or over Facebook. We'll have this recorded and available for folks to watch later. So again, thanks. And I hope everyone has a nice night, and please stay well and be safe. Thank you.
Thank you.